Hi, I'm your host Dave Kemp, and this is Future Ear Radio. Each episode, we're breaking down one new thing, one cool new finding that's happening in the world of hearables, the world of voice technology. How are these worlds starting to intersect? How are these worlds starting to collide? What cool things are going to come from this intersection of technology? Without further ado, let's get on with the show. Hey there, everybody, and welcome to another episode of the Future Ear Radio podcast. In this episode, you're going to hear me interview 6 different audiologists and practice owners from all over the country to really get a sense of what these past few months have been like during the pandemic, starting with the shutdown and then talking through some of the different ways that they've adapted, modified their practice and services, and then how things are looking moving forward as things begin to reopen. So we're going to start with Jill Kasewurm out of Michigan. We'll then have Meagan at Wake Forest in North Carolina, Ronnie Boling in Tennessee, Sheryl Figliano in Youngstown, Ohio, Judy Huch in Tucson, Arizona, and then finish with Jason Aird in Iowa. So I hope you enjoy this episode of the podcast.
My name's Jill Kasewurm. I'm a longtime private practitioner in St. Joseph, Michigan. Basically, I started my business years ago when I graduated, and I've known no other life but private practice.
Awesome. So, through the course of these interviews that you'll be hearing on the podcast, the whole idea here is to just get a sense from business owners within the industry and just different professionals of what this period of time has been like and what life is looking like as things start to reopen. So can you just share with us what March and April in particular have been like, and then kind of like as we go into May or as we go into June and what May's been like, just kind of getting a finger on the pulse of this period of time for your practice.
Well, Dave, I have to tell you that we came off the best January and February we'd ever had in the business, which was great. And then March hit and our state shut down about the middle of March. We still had business because my professionals were being active and calling patients and letting them know, that, let's say we had a couple companies that they furloughed people and their employees were worried about maintaining their hearing benefits. So we were active in ordering aids for them, remotely programming them. We offered curbside or what we now call our white glove service. So we were open. And in March, we did about a third of the business we normally would do. In April, we did about 10% of the business we normally do. Mm-hmm. In May, we started seeing people mid-May in office, and I completely transformed the office. I wanted to make sure it was very safe for patients. So we actually ripped out a wall, and we added a new check-in desk. So there was a check-in desk for our service center and a check-in desk for new patients. We added another waiting area far removed close to the booths so that if people brought someone, if they were having their hearing tested, the other person would sit in that remote location. We limited chairs. We completely transformed our operation. When we opened the doors, our first week in May was fabulous. Now keep in mind, at this point, our state still wasn't open by the governor, but we were deemed as essential services. The second week we were open, not so good. And the third week we've been open is really not good. People are telling us, despite us being very active and calling patients and letting them know we're here and we're safe, our remote or white glove service is going very well. But patients are reluctant to come out because the governor has our state shut down. So I'm concerned, and we are being very proactive at letting patients know we're there and we're safe. But it's going to be a little tougher coming back than I thought it was going to be. It's going to take a little more time than I expected.
So can you tell me a little bit about this white glove service?
So we actually put in an area, we designated a couple of parking spots in front of our customer service center. And we put in a ring camera so that when anybody pulled up in those spaces, it alerted staff that someone was there. We offer it just right now from 9 to 10 every morning. And we aren't allowing walk-ins right now, which we used to do, which helps me really kind of control that part of the business. But we've done everything out there. I mean, it's close enough to our office. We can reprogram when people are out there. People feel safe and they love the convenience. Mm-hmm. And so it's gone very well.
So do you envision, once Michigan opens up, I guess, in terms of what the governor does, do you envision, like, let's say that business returns to a semblance of normalcy? Do you see there being this sort of like white glove service, or maybe like this new sort of remote element to your practice? Like, do you see long-term adaptations to your business derived from this period?
Well, I made my mind up when all this happened that we were going to transform this business and we were going to make it what I wanted it to be. After over 30 years in business, some things had gotten out of control, and this was my chance for
Hmm.
change, because people expect change coming back. We indeed will have our white glove service every day. We're trying to reduce the amount of in-office space visits by 35%. So after someone is fit with their aids, we can do remote programming. But then when we follow up with them like 3 months later, those visits will be remote. So we are very much using this time to transform the business to be stronger and better and more friendly for patients when we come out of this.
Yeah. And so do you think that once you are fully open as a state, do you get the sense from your patients that they will come back? Or do you think that this is going to be something, particularly with the patient demographic being a little bit older, that this could be something that takes a little while for patients to feel comfortable returning? And obviously, you've been doing a lot to alleviate that as much as you can and make them feel comfortable. But do you get the sense that there is a pent up demand, or do you think that it's going to be something that takes time?
Well, I know I've talked to colleagues all across the country, and California and Florida seem to be at 80% of what they were. That's certainly not true in the Midwest. I think, yes, there's pent-up demand, which we've dealt with some because we continued to work with patients all through that time. We were not shut down completely ever. And so, yes, I think there's pent-up demand, but I think it's going to take more marketing dollars to get people to come back and to let them know we are safe, because this virus is not going to go away. It's still going to be there. And I think in our state where we've been shut down, we will have been shut down for 3 months. I think people are a little more reticent in the Midwest. I think, yes, it can come back. I think it's going to take a few months to come back. And I think it's going to take some real marketing and letting patients and your referral sources know that, hey, we're safe, we're dealing with this in every way that we can, and we're not taking it lightly.
Yeah. Okay. Awesome, Joe Kasewurm. Well, thank you so much. Is there anything else that you want to say about the state of the industry right now? That to your fellow colleagues out there.
Well, I just want to say, you read, I want to say that which does not kill us make us stronger. I've questioned that in the last couple of weeks, but this is still a great profession. People do want to hear better, promote the best technology, demonstrate the best technology to your patients, and let them make the choice. And also strongly recommend the accessories that help people hear better, the masks that have the clear centers and things like that, because we will be wearing masks. It's a great profession, and we can still be of very incredible help to our patients, but we need to promote that actively. It's not going to come back by itself.
Awesome. Well, thank you.
You're welcome, Dave.
Hi, I'm Meagan Lewis. I'm the Director of Audiology at Wake Forest Baptist Health in Winston-Salem, North Carolina. We're a hospital system, so our hospital has 3 locations across the triad, and additional 4 offices in our network. So we have a total of 26 audiologists. And I'm here to talk about reopening.
Yeah. No, thanks, Megan, for joining today. I wanted to get a smatter of different, professionals within the industry across the country. So you're sort of my Southeast person, and wanted to just get a feel first off. What's it been like in North Carolina, and particularly within Wake Forest? What's it been like for you in terms of, I know that you've been essential and you've been open to a degree, but can you speak to just like the past few months and then all the way up till today in terms of how restrictive it's been, and then as it's kind of gradually opened up, like what your practice has looked like?
Sure. So we have been somewhat essential in that we continue to screen babies for the NICU and for well baby nursery. We have to take care of those babies. And we actually moved some of our follow-up screening to a smaller location off campus from the main hospital so that it was easier for families to get in without having contact with other folks waiting in the car until it was time for their screening and then coming up. Because we know that that's time sensitive, right? If we've got to get those babies identified. And in fact, right now, if talking about newborns and babies as far as getting them screened, if we have to sedate a baby right now, everybody who's being sedated has to have a COVID test. And they also have to wait and be quarantined, I think, for 5 days before their procedure. So that's a big deal right now if you have to actually sedate someone. So of course we want to avoid that if we possibly can, and because we also don't know how long this is going to go on. So it's super important in terms of those babies that we perform that follow-up. So we've done that in smaller locations, but we've also, in terms of our hearing aid patients, we've been seeing hearing aid patients all along, but in a modified manner, right? So they can do what we've been calling curbside service. And so they can call and tell us, hey, my hearing aid's broken, or I can't hear and I'm without sound. I think that's also pretty critical because people are at home with their family members and not being able to hear them for environmental awareness, I think, and also for just quality of life. Being at home and not being able to hear anything has got to be pretty miserable. So I told my boss that we were preventing more arguments and domestic incidents by keeping people on the air. But certainly when we're doing that, we're wearing gloves and a mask. So that aspect of curbside service is definitely a different avenue than we've done before. I think, one story I have about that, I know I'm getting a little off topic, but I went to see a patient in the parking lot. I couldn't find her. And she finally, because there were multiple cars in our parking lot. We're part of a rehab center. So she honked the horn. I found her and I was able to go help her with her hearing aid. And the way back in, somebody rolled down their window and they said, Miss, do we need to honk the horn before we go in? And so I think it's interesting because there's not really socially, we don't know how to do that.
Right. This is all so new.
Also new, right? So we've done the curbside service, and then we have also been doing some remote programming, which I love as an option. There are bugs to be worked out, but for our patients who are savvy enough, it's been definitely a way for us to keep in touch with them. We've done some patients have picked up their device without having to come in. And then we have been able to remotely program them with the intent of bringing them back into the office to do real ear when possible. But they've been, especially people who've worn hearing aids before and were waiting on something to be repaired, they've been extremely grateful for that. Keeping them on the air, getting, having some kind of life as normal. So, and like yesterday, I had a patient, a mom of 3 kids, and she's had a pretty significant drop in her hearing. So she was really ready to get her devices. And so I saw her in the office yesterday, but we've decided for her follow-up, it'll be much easier for her to be able to do something remotely, because then she doesn't have to find somewhere for her kids to go, and she can access her phone from home for a simple adjustment.
Yeah,
I mean, it's a great option.
Yeah, I totally agree. And I think that what's interesting is, like, just from the conversation that we had prior to recording here, it's like there are definitely some short-term modifications that, we don't know how long these modifications will be. Like you mentioned in your patient waiting room, you guys have spaced it out a whole bunch, right? Where, allowing for social distancing within there, and you're trying to space out the patient appointments so that you don't have a whole bunch of people in there at once. But I think this is really interesting where you have these technologies that maybe were readily available prior, like these remote fittings and the ability to do this remote aspect of this. Do you see that being something that's like this remote telehealth type aspect of your job now? Do you see that being something that you'll probably implement longer term?
Yeah, absolutely. I think definitely the technology was there as we discussed, but there wasn't a real impetus
Mm-hmm.
to kind of push us off the the ledge, so to speak, or jump in the water.
Mm-hmm.
But I think now that it's there, I love it as an option, especially for people who are driving long distances.
Yep.
I think as a patient that is huge. I think it gives them much more flexibility, and they may be more apt to have an adjustment because they don't have to drive to have that done or to touch base with their professional. It's a great option. I don't see it going away.
Yeah.
I think now that we have it, it's here to stay.
And I love what you said too, where it's like you still I think this whole idea of like a hybrid makes so much sense to me, where you have somebody, they come in that first time, you see them face to face, and then you evaluate that, you know what, maybe for your follow-up visits, it might make more sense for a more remote, type follow-up. And I just think that optionality is really, really important. So as we sort of wrap up here, I'm curious, like what's your gut tell you in terms of going into June? Are you getting the sense that there is, within your patient base, that people are becoming more, open to the idea of coming and seeing you? Like, are you feeling kind of an uptick, or what's your sense of the volume of business right now?
Yeah, absolutely. So I think we definitely have people who are ready to come in.
Mm-hmm.
They've been waiting, they're ready, and they're ready to move on kind of with life in general, and they're ready to come in. We have several consults on the schedule. The thing is that while our schedules are full, and I've actually had to thin them out some so that we have physical space, like you mentioned, in the lobby,
Mm-hmm.
to try and keep people from being, on top of each other. We have had more no-shows than we had before. And I think that some of that is there's this, as we start to open up, there's this trepidation of what can I do and what can I not do safely. And think it's interesting, and it's been very interesting to observe how that works when people come in through our lobby, right? Because everyone, of course, is being screened at the door. And if they don't have a mask, they're being given a mask. So there have been several folks who get through check-in and they come back to see the audiologist, and then I think they feel safe and so they can take their mask off.
Yeah.
So
this is so new.
It's so new. Well, it's kind of like I was talking about in the parking lot. We don't have a social script for this.
Right.
It's a, what do I do? I'm not sure. How do I have to wear my mask all the time?
Mm-hmm.
Do I have to wear it in the booth? Do I have to? It's definitely been, and will continue to be, I think. We're rewriting our social mores.
Right. Yeah, I totally agree. Well, Meagan, thank you so much for coming on and sharing the experience and what things are kind of like in North Carolina.
Thanks so much, Dave.
Hey there, this is Ronnie Boling. I'm the practice manager of Brentwood Hearing Center in Nashville, Tennessee.
Ronnie, thanks for joining us today. So I wanted to bring Ronnie on along with the other folks. Ronnie's sort of the guy that I'm bringing from the South in Tennessee. So wanted to get a finger on the pulse of what it's like there. So Ronnie, can you share with us, what this period of time has been like for your practice, going back to maybe March and then, where it is today, just in terms of, how you've adapted to this situation and some of the different things that you've done to manage this period of time.
Sure. Well, thanks for the opportunity to share. I've found that whether I go to a conference or whether I go to a committee meeting or anything like that by a manufacturer, some of the greatest value that I get back is learning from my peers. And so maybe some of the things that we're able to do can help somebody else. And we look forward to listening to the other podcasts, to learning from others too. If I'm the guy from the South, maybe I should begin by saying howdy, y'all.
Yeah, exactly. Howdy, y'all.
It's good to be with you. What's it been like for Brentwood Hearing Center? It's been very different. Obviously, it's been different for everybody. Our patient population would be in the aged or the aging. I think our average age patient's about 69.1 years of age. So in addition to listening to media outlets and the fear that kind of pervades our society right now, our patients are even more cautious, I think, than the younger set would be. And so they've been very careful to stay in. We took the position, though, realizing that our government, our local and our state government, didn't have real specific guidelines on practices like ours. We took the position, while we always wanted to make sure that we were being careful and adhering to appropriate protocol for both our employees and our patients, that hearing was essential. When our patients have been isolated, it's even more important for them to be able to hear their television and to hear their family and friends when they talk on the telephone. So we've really tried to promote the technology that's available to those patients during this time to make sure that while they've been holed up in their retirement centers, and some of our folks still can't get out, that they're able to hear.
Yeah, can you speak a little bit about some of the different marketing tactics that you've used during this time? I thought that what you had mentioned to me was really interesting about some of the things that you're doing with, television and radio, and then, something even like a physical newsletter. Can you speak to how you've been using these different channels and the efficacy of those channels?
Sure, I will. When something like this hits and you realize that your revenue is going to be impacted, and ours has, our revenue has been impacted. We've had the benefit of the Payroll Protection Program loan, which our bank was one of the first ones to get on board. In fact, with a banking background myself, I made sure that ours was the first application processed by our bank. So that's really helped. But when something like this happens, the first thing we always want to do, realizing that our revenue is going to take a hit, is find a way to cut expenses. And we spend 10 to 12, sometimes up to 14% of our annual revenue on marketing. And the larger set of that marketing expense is what I put in the brand awareness category versus the call to action, which is our print materials and recall cards. But radio and television, we have an endorsement on local sports talk radio, and we also have an ad that runs 2 full weeks, alternate days, on our local lead television station, which is the CBS affiliate. So the first thing I thought is, let's look at those marketing expenses, because that may be a way to cut. And so I talked with my representative from the television station and the radio station and said, hey, I'm looking at cutting back a little bit. What do you think? But before I make that decision, can you tell me what's your viewership like and what's your listenership like right now? Now, I realize both of them are in the business of selling ads and keeping customers on board, just like we are. But they're being very honest with me, and they shared with me their numbers, where their viewership and their listenership was sometimes as much as double what it was. And so I did look at other ways to cut some expenses here at the office and found some ways, but I made the strategic decision that from those marketing outlets, I was going to leave those in. And because I decided that, the radio station and the television station actually gave me free spots.
Wow.
And so I wanted to make sure that during the time that people were isolated and they're watching television and listening to the radio more, that we were in front of them just as much as we had been. And it's proved to be really, really successful. We've gotten a lot of feedback from patients that I saw you on television. Thanks for changing your message to make sure it was appropriate and reassuring us. So those 2 outlets, we feel like have remained very constant for us. And as far as the call to action, we've also done some other things to make sure, whether you're in the business of selling medical supplies like Oak Tree products, or whether you're at Brentwood Hearing Center and you're selling hearing care, it's important to make sure that we always realize that the best source of new business is always going to be your new customer base. And we like to reach people via television and radio, and we like to reach people versus our signage being appropriate on the back of our building when people drive by, going back and forth to Nashville, which millions of cars do every day. But staying in front of our existing customers is very important. And so during this time, we wanted to make sure that we did that. What message did we communicate? Well, one was, we're here for you. Let us know how we can help you. If that means driving up and us going out and getting your hearing aids off of your windshield, in a baggie taped to your windshield, glove up, mask up. We'll come out with a Dixie cup and a red Solo cup and bring them back in. We'll look at them. If we need to send them off, we will. We'll let you know when they're back. Drive back up. Let us know when you're here. We'll bring them back. So whether it's drive up, another successful, drive up, reassuring patients that we're here, whether it's drive up, telecare has also been a very important thing that we've been able to do. Remote support programming through apps on their telephone, telecare through our patient management system, where we're able to help patients get back up and running, to change a filter, to change a battery, to clean out a ear mold, those kinds of things. So those have been important. We stayed in front of our patients also with our semi-annual newsletter. Obviously, the message changed. We tried to have a couple of funny cartoons about the results of COVID. Our recipe that we always do, I put my favorite lemon sour cream pound cake recipe in there. But the primary message that we put in the newsletter, in addition to our new protocol of how we're going to be when we're open back up, is hearing care is healthcare.
I love
how
that.
How important your hearing is. And while it may seem easy to, it may be easy to, please don't neglect that and let us know what we can do. How's life going to be going forward? Things are beginning to pick up. The phone's ringing more. We really feel like that sending our email blasts, sending our print newsletter, all the things we're doing to stay in front of our existing customers to get them back in here is good. Tennessee has probably opened up a little bit earlier than other states, and so that's made it easier because our clientele does watch television a lot, they listen to the radio a lot, and they follow the direction of local and state authorities. And so the fact that the authorities have loosened things up or opened things up a little bit have made it a little more encouraging for our patients to get back out.
Yeah, that's fantastic all around. I think it's so interesting what you said about, you obviously are looking for things to cut, and it's like, well, should we cut these marketing expenses? And rather than cut them, you sort of doubled down on them, which seems to be a really prudent and, strategic decision on your part. And I love this idea that, obviously new customers are really important, but also the existing customers are equally as important, and all of the messaging and tailoring those messages, based on the situation, in helping to appeal to this sense of, we are a essential service for you. Hearing care is it's healthcare. So I just love everything that you said there, and I think it's really interesting. And talking to different folks from around the country, it is different. Michigan, it's not quite open yet. In Tennessee, it is. So I know that plays a big role, in this whole thing. But obviously, as things start to open up, I hope that more and more of the total patient base, if you will, feels comfortable, and that the providers out there do a good job of, ensuring that sense of confidence and instilling that within them, that this is a totally safe environment for them to go.
Yeah, I think at the end of the day, Dave, while our message has changed and many of our methods are changing, our focus is still on the patient experience. And first and foremost in the patient's mind today of their experience at our office is safety, making sure that we are taking every precaution, whether it's using gloves, masks, face shields, whatever. We have masks available to our patients if they don't bring their own. But when they call to schedule, we encourage them, to bring their own mask, and we will have ours when they're here. So it's all about the patient experience, safety being first and foremost, but then also making sure that the patient knows that this is a relationship, this is essential, and we are here to make sure that whatever their need is, that we want to make sure that if nothing else, one of their joys in life is still being able to hear their children, their grandchildren, their spouses, their television, and their radio.
Awesome. Well, Ronnie, thank you so much for giving us a sense of what's been going on with your practice down in Nashville. We appreciate it.
Well, you're quite welcome. And, you know, given that so much of Nashville's economy is based on tourism, let me just end by saying, y'all come on down.
Come try your famous lemon pound cake.
That's right. That's right.
Some hot chicken. All right, cool, Ronnie. Thanks, ma'am.
Well, thank you.
Hi, I'm Dr. Sheryl Figliano. I am a doctor of audiology. I have 7 private practice offices in the Youngstown, Ohio, or northeastern Ohio area. Most of our offices are located right between Cleveland and Pittsburgh. And I've been with this company for 31 years and a long time customer of the Kemp family. I want to add that because what year did you open?
We opened in 1993 when I was like 4 years old.
Yeah. Thanks for rubbing that in. But I've been a customer that long, and you guys still give amazing customer service.
Thank you.
So I just had to throw that in there because it's true.
Yeah. And like I was joking earlier, you probably, you alone have probably helped to like pay for a year of my college education or something. So thank you.
I know I have, and you're welcome.
So thanks for joining me today. I'm getting, this is the 4th one that I've done now, and I'm just getting a different array of people from all around the country, within the industry, trying to get a sense of what this time's been like for you. You're sort of in this like Rust Belt Northeast area, so a little bit different than anybody I've had. And I'm just really curious, what has this been like in Youngstown? Going back to say March, you had a really interesting comment. Your last name Figliano, you're married to an Italian, so you have family in Italy, and so they were very aware of the severity of this. So it sounds like you were pretty open and aware of just the extent of this, of what this was going to be. So can you speak to what this has been like for you in your practices?
Oh, absolutely. Well, in Ohio, we were considered essential, so we didn't have to close. But my husband and I, who's my business partner, chose to close because we wanted to keep our staff safe. We wanted to keep our patients safe, and certainly keep the curve down. But a lot of that had to do with his family in Italy. I mean, we had daily conversations out of concern for them because the situation there was just so grave. I think our staff maybe questioned, oh my gosh, why are we closing? But it got bad. And we had friends that were in serious situations and that were hospitalized. So we had services still open for emergencies, but really curbside and very, very few at that. And as I was mentioning earlier, when we decided to slowly start to reopen, the first day we reopened and brought staff back, it's almost like the first day back from school after summer vacation. Mm-hmm. But now not only are we getting back into the swing of things, but now we have all these new things we need to worry about. So I had everybody watch AU Bronchitis's infection control classes on Audiology Online. And after everyone watched that, they felt so much more comfortable, because what we all realized was that all along hearing aids have had some really bad things on them, viruses and bacteria, and everyone kind of went, oh, wait, we've already done this. We know hearing aids can carry some pretty dangerous things. Mm-hmm. And so we just need to be careful like we've always been, and maybe even more so, clean everything, disinfect everything, wash your hands. And so everyone slowly kind of started to grasp with having to deal with all that. And then by day 3, we were like a well-oiled machine. Everyone felt comfortable. But with new ways, right? We couldn't open our doors and have all the floodgates come in. So we came up with some new ways to do things. And one thing that we absolutely love and we will continue to do is our curbside service.
Yep.
And I don't know why we haven't done it before. And even if it's raining or snowing, which we've had all of that here in Ohio, we just have a raincoat and umbrella, and patients get a kick out of it that we're coming to their car. We can see higher numbers of people and still stay safe because they're outdoors. They're in their cars, so we're social distancing. And they're happy as a clam because, most times that they're here, it's a simple cleaning. Their wax filters are plugged. It's simple types of things.
Mm-hmm.
But we can see a higher number of people. And everything is prepaid. So if there's a charge for something when they make their appointment, they pay by phone. It's the new normal. And what's wonderful is we're getting a payment for everybody because they know in order to be seen, they have to make their payment by phone. And no one has a problem with it because it's what's required everywhere you go now. So we will definitely continue having a day of curbside service because, again, it's less traffic in your waiting room. You don't have to clean everything. We have cleaner bathrooms because patients aren't coming in and out. They're not tying up the front staff with social chit chat and coming early to have coffee or to scratch off their lottery tickets. It's a very efficient service. People are still getting great care. They feel like we're treating them very special because we're coming out to them, even if it's raining or snowing. And staff loves it because we're not stuck indoors.
Mm-hmm.
So it's just been wonderful, and we'll continue to do that.
So tell me about the remote services piece. You had mentioned that a little bit. Is this something that you guys are embracing in your practice, doing more of these remote services?
We absolutely are. And I don't know why we didn't do them sooner. I think probably like everyone else, day to day, you get so busy and you think, well, we don't really need that. Patients are coming to us and we like to meet with them one-on-one and get to know them. But it has just been such an amazing change here to our practice because our new rule is when you come in as a new patient, we set up a half an hour telehealth appointment. And then a couple days later, we set up a regular appointment for whatever they need. Maybe it's a diagnostic evaluation. And 99% of the patients in that first half hour telehealth end up knowing exactly what hearing aid they want when they come in. And it cuts down time then for their appointment in the office. We've already gotten to know them, established in a relationship. They see the provider they're going to be seeing, and they feel comfortable with them. We've picked out styles of hearing aids and gone over, what the features are. So when they do actually come into the office, it's a quick hearing test, maybe impressions if they're necessary, and they're out the door. And it has just streamlined everything. And also it weeds out the patients who aren't ready to buy, or you find out you're not a provider on their insurance plan, whatever it might be. And it's freed up so much wasted time that we used to have on our schedule. So telehealth will be a staple for us from this point forward.
I just think that's so interesting. I've had conversations before on the podcast where we've talked about how it can be used for existing patients, but that's actually a genius way to use it for new patients as sort of like this, almost like evaluation, and say like, okay, so let's just get a baseline understanding of what you're looking for. Because to your point, then you get them in there and you already have so much information on exactly why they're even contacting you in the first place. That seems like a no-brainer to me.
Right. But why weren't we doing it before?
Mm-hmm. Well, it seems like we needed something maybe to push the industry toward, forcing us more or less to adopting some of these things.
Right. By the time the patients come in after just that half an hour telehealth appointment, you feel like you're old friends with them.
Yeah.
They've told you about the kind of wine they like, or who's complaining about their hearing loss and what spurred them now to make that decision to get them. And it's really, really beneficial. So I would encourage everyone out there who hasn't done it, just set up that half-hour telehealth. We've even thought about calling it telehear or telehelp, or putting some different spin on it. The other interesting thing is, being here in small town USA, patients are wowed by the telehealth. They say things like, "Oh, you're just like the big hospitals. You're now doing video telehealth." So they feel like, we're really up with the times
That's
and
cool.
providing those services. So yeah, it's really been a great addition to what we've been doing.
Love it. So let me just ask you, as we kind of close out here, what's your sense in terms of, small town America and, up in that area that you're in Youngstown? Are you feeling like there's a semblance of normalcy that's returning within, are you seeing, a relatively normal amount of patients relative to what you were pre-pandemic? Or do you think that it's going to kind of be this new hybrid approach where you're seeing in, some in person, some, more face to face? How are you thinking about that?
I think if we opened our doors and were business as usual, that people would start flocking in.
Mhm.
Now that the governor has relaxed a lot of the restraints in our area, people are anxious. People don't understand why we're not, fully open. We are going to continue to embrace this, as you called it, hybrid model, because it's so much more efficient. We bring in patients one at a time to see them one-on-one, so that our staff is safe and that the patient is safe. And they get one-on-one attention. They're not rushed. All of the other things like telehealth has cut down on the time that they're needed in the office. We have a supply pickup day. We only have one day in each office a week that people can come in and pick up their batteries and their supplies. It's worked out brilliantly, and it's cut down so much traffic coming through the office. And again, I've just found that we're just so much more efficient with these new things that we've done, that I don't want to go back to, 30 patients a day streaming through the office. I want to keep it more low key and more one-on-one time with the patient. So, for those of you out there that haven't opened and you're nervous about opening, people need us. People with mild hearing losses found out how much they're struggling when they're around their family more, during quarantine times.
Everybody's wearing masks.
Everyone's wearing masks, so even mild hearing losses are more noticeable. And then throw that on top of the stimulus money that everyone's gotten. And, the woman I'm fitting this afternoon said, I want to spend my stimulus money, and what a better thing than something to improve my quality of life.
Totally.
So come up with a new normal, embrace the new normal, work efficiently, and you're going to find that people are really, really happy when they can hear well.
Yeah, absolutely. Well, Dr. Figliano, I really appreciate you coming on and sharing what, life's been like up in Youngstown, Ohio.
Thank you for having me.
Hi there, this is Judy Huch with Oro Valley Audiology and Grace Hearing Center. I'm located in Tucson, Arizona.
Awesome, Judy. Well, thank you for joining us. You are our Southwest representative, I'll call it. But really wanted to get a sense from you of what things have been like, out in Arizona, out in Tucson, going back to, say, March and then up to today. Can you just kind of share that story of what things have been like for you in your practice?
All right, so in early March, when COVID really started to spread across the country, and especially in New York, where it had really started to get serious, we were trying to figure out how best to serve our patients. And it was about March 16th that we just decided we needed to lock the doors and just figure out what we needed to do, because there was a lot of uncertainty on how it spread and what PPEs we should have, if we should even see people. I do a lot of QTC testing for the VA, and there was no guidance from there either. So just trying to look at CDC, OSHA, and our state guidelines was very difficult. So while we closed, we still did curbside. Um, but we just did 4 hours, 4 days a week. And we all decided to start doing some projects. Some pretty awesome things that we made is I have a locker system set out for a touchless pickup system, and a nice drop off. I married an architect who's pretty handy. So kind of cheap labor for me. But that worked out really, really well. And the weather was beautiful in March and April. It's today it's supposed to be 107. So
Wow.
we're changing our curbside times a little bit. But we've made an AR program. We are changing things around to expand our cognitive program, our tinnitus program, but we just really got in the trenches and decided we are going to come out this better and stronger.
Yeah, no, that's so cool. And this curbside option with the locker that you described, can you just tell me a little bit more about that? That sounds really, really interesting.
It has 4 smaller lockers, so you could probably put 2 shoe boxes in them.
Mhm.
And I'm 5 feet, so it's about 4.5 feet tall. And we can change the combination. So the initial combination, we just picked a date, and that's what they're all set to. And then each person that has to pick something up, then we make it unique to them. They open up the locker, take what's out, and then we go back, sanitize it, reset it, and we just keep track of everybody. And it's worked out really nice.
Yeah, no, that's interesting. So it's like, are people dropping off their hearing aids for repairs and picking up things like batteries, or what are you putting in this lockbox?
So if people can't make it, especially when we had the reduced hours, if they couldn't, well, when we weren't letting anybody into the building, we would put it there to pick up. Now it's just for weekends, or if they're uncomfortable in coming into a public place, then we have the option to give them this touchless option. And we let them know how we sanitize and all of that, but it's gone over really well.
Yeah, that's interesting. How about remote services? Have you guys been doing more of those than before? Things like any kind of remote, fittings or just remote evaluations, anything of that?
We are doing more because we didn't do any before the pandemic. And but it has been a bit challenging with our population to
Mhm.
take it on. I have some younger people because I do tinnitus counseling and tinnitus therapies. And so I've been able to do it a little bit more, a little bit easier. But we've done remote fittings, hearing aid orientations. We've pretty much done everything. But now it's a choice, but most people
Mhm.
are still choosing to come in. And we had 150 people on our waiting list, so we're working through that right now, and we're starting to get our referrals back up too, so it's hard to keep up.
Yeah, yeah. So, what's the sense in Arizona right now? I mean, it sounds like you have 150 people waiting. Do you get the sense that people are kind of anxious to get back, or do you still feel a little bit of, people being a little hesitant to come and see you all, and maybe some of the things that you're doing to alleviate some of those concerns?
But we have the gamut. We have people in the area that I have the practice in Northwest Tucson. it's a retirement area for sure. I call it the Scottsdale of Tucson. And it's so people are ready for life to be back to what they perceive as normal.
Mhm.
But there are a few that decide, well, I don't want to do my clean and check inside yet, so I choose to do curbside. And so we're cool with that. But we've taken surveys with our patients to see what's important to them and to let them know what we're doing. We've just really tried to keep a pulse on everything. And so far, the feedback has been really nice. I haven't had anybody refuse to, we make them wash their hands when they first come in. And if they don't have a mask, we provide them one. And we have medical purifiers in the booths and then regular purifiers in the rest. And I'm debating on a UVC light in the booth on that as well. But AU has really helped. I was on a task force within Theo's infection control, and she helped so much helping us get all of that together.
Yeah, shout out to AU. She's this is the second time she's now been mentioned on this podcast, but AU Benkitis, Dr. AU Benkitis, she's the champion for infection control. So it's been cool to see her really step up and use her all of her knowledge with this and how it applies to this specific type of virus. So I'm glad that you two were able to work together on that. Well, cool, Judy. Well, thank you so much for sharing your perspective of what's been going on and how things have been in Tucson.
All right. Thank you, David.
Hi, I'm Jason Aird, an audiologist in Coralville, Iowa. We've got 7 locations for our practice, and our practice has been around since 1981, so we've got quite a few years behind us. We have 3 providers and several support staff members. And it's been a very interesting time here.
Yeah, absolutely. Well, thanks, Jason, for joining us. You are the last one that I'm interviewing here, right in the heart of the country. So I think another unique perspective. So tell us a little bit about what this time has been like, going back to, say, March in Iowa up until about now. Can you just share what things have been like in Iowa and then also specifically with your practices?
Okay. In Iowa, starting in March, the beginning of March, everything was pretty normal around here. That yes, there had been some news clips about what was going on in COVID. As far as our practice, we were going the same pace that we had been. Within the first couple of weeks of March, that's where everything started to escalate. Our practice started to take a look at what we needed as far as protocols for people coming in on a loose end comparative to where we are, and how we're protecting staff and going through that process. And probably the third week in March is when everything hit, and we pretty much shut down with the exception of doing curbside and phone calls and some telehealth, and had to try to regroup as to what we're doing, what we need to invest into our business, and how we're going to keep our business moving forward.
So you've obviously made some modifications. Before we started recording, you actually sent me some pictures that you made of the different like protective shielding that you've done within your practice. Can you just speak to, not only that, in terms of how you've outfitted your practice to accommodate for, a more hygienic and, to create barriers and personal barriers and such. But can you also just speak to some of these different call them adaptations that you guys have kind of created during these times?
Sure. First adaptation came from the front office. We have a pretty open design as far as our clinic, that yes, we keep everything confidential and conscientious of HIPAA and all, but nonetheless, it's a more open type of a design. Mm-hmm. Very welcoming, but not very good for this type of stuff. So the first adaptation came to closing some of those areas off and putting up some barriers. And when I was going through that and looking at it, just getting the sense that this wasn't going to end tomorrow or 2 weeks from now, or we'd have a 2-week shutdown and magically it'd all be better. I thought, well, if I'm going to take the time and build something, let's build it so it can look nice and we can keep it in place for a good bit of time. And if, this is all over, maybe we remodify it and make it look even nicer. I wanted something functional. I wanted something that our staff was going to feel very comfortable with, because in the earlier stages, it didn't quite seem like the whole populace was grabbing onto this. So, we may feel the gravity of it, or as a business owner and taking that onus of responsibility on for your staff and for those people coming into your clinic. I felt we needed to make people feel comfortable. Within the exam rooms, then I was trying to take a look at that and talking to a very good friend who was helping structure things for the University of Iowa hospitals and clinics. The first thing he was saying was they were taking everything out of the rooms. And it is amazing of how much stuff we have in a room, even if you think it's a pretty scaled down room. So that was kind of the first step. And then putting up barriers. Barn doors seem to be the in thing right now. So that was where I built a plexiglass barn door that looks nice, and you can slide and still get people in and out and have the practitioner feel pretty comfortable about everything. So those were some of the main things that I was going through and taking into place. It's just a lot of things to think about, and I had a lot of good help on designing the rooms and getting the stuff out of the rooms that just doesn't need to be there.
Yeah, no, I think that is really interesting that, this idea of kind of creating a more hygienic atmosphere. And obviously you want to ensure your patients, that they're in a safe and welcoming place, kind of like you've done. Can you speak to, this curbside? I know that, across all 6 of these conversations now, curbside's become a thing. I know, just in talking beforehand, you had mentioned that wasn't something that you were really doing before. So, and I know that you're doing some stuff with like a Ring camera and Amazon Echo Shows. So it sounds like a really interesting way that you've sort of approached this whole idea. And it sounds like it might be something that you will continue to do, beyond this period.
Right. You're correct. We didn't do any curbside before. And actually it never really even came up as a thought in my practice. We would have drop-offs and that type of stuff, but that still entailed somebody coming in the office and dropping their stuff off to the front staff. One of the things that we have done was to have our staff, as much of the staff, remote care as possible, and also remote schedule. So we have very few people in our office. We are keeping our front door locked at this point in time with signage. And when people show up, even for an in-person appointment, they're just to call our office. They ding us on our system, and then we go out and get them so we can check temp and make sure they're masked up and come on in and do our thing. With the curbside, we pretty much implemented that when we were just shutting everything down, because we knew there's still people that need something, and there wasn't too many reasons why we couldn't be doing some of that anyway. So our staff, we just started rotating, saying, you get this day and we'll get that day, and kind of go through that process. To me, it's been very beneficial, and the patients actually love it. For a lot of people, if they have mobility issues and they just needed to get something cleaned or checked or new tip or tube put on, they can just roll up and we come out and get it. And if it's a nice day, it's all great. And it's quick and easy. So that's been a really good thing. And I can see keeping that in some respect throughout the time. It cuts down on our walk-ins. And that's been one of the big changes too, that we have all, it's great to have people that want to come in and see you, but just the random walk-ins was just starting to really build. We've got a large practice, and over the course of the years, you get enough people, it's just statistically going to happen.
Yeah.
And this is a good opportunity for us to just retrain how we're doing everything and kind of set that process in place.
It's interesting, like across these conversations, this has sort of been a reoccurring theme, which is that, these are short-term changes, if you will, that you're making, and then you sort of see them as like, okay, maybe this is something that would be viable longer term. And another one that plays into this that I know that you were actually early on, you said that you had been doing this for a few years, but it sounds like it's really started to pick up, is the remote, like telehealth offering. So can you speak a little bit about some of that aspect to your business now?
Right. So we have the telehealth in a couple of different ways. We do have it through Counselor. So that's one way that I know has been very easy for patients. The problem is not everybody we deal primarily with the geriatric population. So if we give them that choice of saying we can have a practitioner call you, or you could do a video conference, and maybe that would be a little bit more useful. Majority of the time, they're still just saying, just have them call me. But we're starting to get people integrated into that. It's showed us as well that we need to do a much better job of capturing emails. We thought we were doing a pretty good job, but we could have been doing an even better job. So that was a learning curve on our part. We also have been working with the manufacturers and doing remote adjustments for the last couple of years since that stuff came out. It intrigued us. We do have a rural population, so for somebody to drive an hour is not out of the question sometimes to come into one of our clinics. If it was just a quick adjustment, we thought, well, this would be great. Implementation is a little bit more difficult, and I think we're making a lot of headway. We as practitioners learn now that if we have a new fit, we get them all set up whether they think they'd want it or not, with their phones and everything. And then it's much easier because there are many more steps to go through for a lot of the manufacturer types of telehealth that have to happen versus just clicking on an email and it's all done.
Yeah, I think that's really, really interesting. So as we kind of close out here, can you just share, what's your general sense of how things are going with your practice in terms of the reopening, right? Are you starting to see a uptick in volume in terms of, people wanting to come see you and scheduling appointments? Are you getting the sense that the volume is returning?
Great question. And we are probably 2 weeks into patients in-house as well as the curbside and reopening some of our outlet clinics. If this were to happen that we were trying to open up 2 or 3 weeks ago, we were having people calling us, even though we were sending letters out saying, we're canceling your appointment for now. If you need curbside, you can do that. So people were canceling left and right on their own. Mm-hmm. Now we're seeing people coming back in, calling in. We are starting to see some new evals, which is a good thing because I know we love to take care of our patients, but you also need that revenue stream to come back in. So for those types of things, we're seeing a build. I don't foresee it being the same way it was pre-COVID. And that those are some of the business aspects that we all probably have to look at and to say, where are we really lean at and where are some of that fat that we need to be readjusting and moving around from clinics to whatever we're doing. So the positive thing is at least seeing people calling in. Iowa's been a little bit different with the lockdowns comparative to some other states that being more rural, there were a lot more people out and about anyway. So it wasn't a complete lockdown, but people were avoiding if they didn't have to go in somewhere. They didn't, people were doing curbside pickup, groceries, that type of stuff, food. But now I think people are feeling that it's a little bit better. I'm sure it depends on each state too, as to how the top-down approach is, as, hey, it's all better, everybody go out and do whatever, or you still need to have your precautions. I know with our practice, we are sticking tight on our protocols and how people come in our office and how they're going to be treated and keep everybody safe.
Yeah, no doubt about that. And you're right. It's definitely been different, across all 6 of these conversations that I've had. It sounds like it's just been a little bit different in each area. But what's been positive in my eyes is that it sounds like there are things that, I guess call them silver linings, but it sounds like this has been a period of time where you have kind of, to your point, been able to examine, your internal business and see, okay, what are the things that maybe we need to refine or we need to fine tune. So at least it's been an opportunity to sort of optimize your practice, if you will.
I completely agree. And even our time management, for many of us running our practices, you run pretty hard and you work very long days, and we all sit there and say, why are we doing this? This hard, you think maybe I could take a little bit more time off. And this did prove you can take more time off if you really needed to, up to a certain point. But all of my friends that own their practices that I've been visiting with, they all have a similar aspect as to when we ramp things back up to the more full-time, we're not going to be working as many hours as we did before. So that's been another opportunity just to know what is really meaningful in your life.
Yeah, absolutely. Well, thanks, Jason. Appreciate you coming on and sharing what's been going on in Iowa.
Thanks for having me.
Yep. Thanks for tuning in today. I hope you enjoyed this episode of Future Ear Radio. For more content like this, just head over to futureear.co, where you can read all the articles that I've been writing these past few years on the worlds of voice technology and hearables and how the two are beginning to intersect. Thanks for tuning in, and I'll chat with you next time.